make it hard to talk about you. Like what I see.
Hey you guys, it's your girl Dosage Raquel and I'm back on YouTube. Welcome back to my channel. In this video, I am going to be doing a semester 1 recap on how level 1 went for me in nursing school. I attend Northwestern State University, and if you're an OG, like back in 2019, like yeah, I ended up failing out of nursing school in 2021, but that is a story for another day. If you guys would like a video on that, a separate video, definitely let me know down in the comments below. And also don't forget to subscribe to my channel if you haven't already. Also like this video and definitely click the bell that's at the bottom of this screen, so that way whenever I do post new videos, you guys are notified. So as I was saying, this video is going to consist of like a recap of like what went on, what classes I was taking, how I was able to be successful. As you can read by the title, your girl passed level 1 with a 3.67. So I like to round that and say your girl passed with a 3.7. Clap for me. And I'm going to show you guys, and well, I'm going to tell you guys like how you can be successful as well. Little backstory: I am a mom. I am a single mom, and like I have to work full time. The bills don't stop. It gets tough, I know. And I think part of my reasoning for wanting to come back to YouTube and share my story is because not only is it an inspiration to others, but it also just shows me like, okay, you can do this. Like, it might be difficult, but you will get through this. So let's get started with the video. Enough rambling. In level 1 at Northwestern, after you take, so let's backtrack. In order to get into your pre-nursing classes, you have to pass the T's. So we do everything through ATI. So I passed my T's. I made an 83 on that. So then after that, I went on to take Patho, and then I took like another class with Patho. But at my school, it's called Patho and like course to professional, hang on, it is called nursing as a profession. So I have my laptop right here for references, and I have my iPad, so just in case I need to look at something, that's what I'm looking at. But anyways, I passed both of those classes, and then I went on to level 1. So level 1 consisted of, on Mondays, I had lab. On Tuesdays, I had clinical. Wednesdays was my off day. Yeah, Wednesday was my off day. Thursday, I had fundamentals. And then Fridays, I had health assessment. So I'm going to start off with Mondays because that's the first day of the week. So Monday, that was lab. So lab was from 8:30 a.m. to 3:30 p.m. I passed lab with an A. So that class consisted of, basically it was the hands-on skills. So anything that we were going over in class, we would watch videos on that, and we basically went to class and practiced it. That way when we got to clinicals, we knew how to perform that skill. So we had to do checkoffs. Our very first checkoff was vital signs. And on first, it could be like super scary if it's your first time going into it, because of course, like if you work in the hospital, you do everything like with the vital signs machine. Like everything is connected. Like you have your thermometer on there, your blood pressure cuff, you have your pulse ox on there, and something else. So it's like when you're going into it and like having to use your stethoscope and your sphygmomanometer to measure blood pressure, it could be a bit challenging, a bit scary, but it's very doable. So anyways, that was our first check off. I was good at that. So anyways, that was our first check off. I was good at that. Our second check off was medication administration. So we use Lippincott for a lot of our stuff, and so Lippincott has this new feature like DocuCare included in there. So we were able to like actually like take a handheld scanner and like plug it into our laptops or our iPads, and we could like scan the barcode like on our mannequins, which was like really cool to me. And it would like show up like on our screen like, hey, you just scanned hydrocodone, or you just scanned insulin, or you just scanned morphine. So for that skill, we had to administer an oral medication. We had to know our 6 rights of medication. We had to verbalize that. We had to administer an IM, an intramuscular medication. And we had to either insert an IM medication either in the deltoid or in your ventrogluteal muscle. That was not bad at all. And after the medication administration checkoff, it was a central line dressing change. We had to like practice being very sterile, like putting on sterile gloves, how to change the dressing, how to clean the port. Many seconds we have to like scrub the port and stuff like that. So that was a very good checkoff. However, it's a very tedious task, so you just have to be very careful. That's the only thing. And you have to take your time, and you have to actually think like, okay, what am I doing next and why I'm doing this? After that checkoff, we had Foley. So we had to insert a Foley catheter, and we also had to remove it. That was all part of one checkoff. Again, that's practicing being sterile, not contaminating your patient. And then we did all of these on mannequins. Our vital signs one, we did that on each other, but the other ones like medication administration, that was the ones that we did like on mannequins and everything. Insert the saline into the balloon, record like how much urine like was in the bag like whenever we went to disconnect it. So it was like a lot of role playing in lab, which was really, really fun. After the Foley one was the head to toe assessment. So with the head to toe, it literally is what it says in the name. So head to toe, we're looking at pupils, we're looking at their skin, the temperature, looking at their fingers, looking for any clubbing, any edema. We are looking at how their lung sounds are, their heart sounds. Is there a S3 or S4 heart sound? We're looking at how their chest rises and falls. And again, all of this is very helpful because when I talk about clinicals, that's pretty much what we're doing on our actual patients. So we're listening to the lung sounds in the front, the side, and the back. Definitely know your terms as far as like anterior, posterior. Know your medical terms when it comes to stuff like that, especially for documentation, because after each checkoff, we did have to document what we found. Of course, everything was normal because it was on a mannequin, but like, of course, for clinicals, it's not always like that. So you need to get used to doing effective and correct documentation because they will correct you on it. After that, our last checkoff was the comprehensive assessment. So that just consisted of everything. So we had to verbalize the vital signs, like to start it off, and then from there, like, we're just doing everything. We're going to give a medication. We are going to do a sterile procedure, whether that's changing a central line. And the thing is, like, they don't tell you until like you get called in. So everybody had something different. You're either going to redo a central line dressing change, you're either going to be putting in a Foley, how to attach the restraints to a patient. Never attach it to a movable part on the bed. That is number one. That if you don't know anything else about restraints, it doesn't attach to a movable part of a bed because like it can harm the patient. Of course, like, we did the whole head to toe assessment again as part of the comprehensive assessment. So again, lab was not hard. Just if you like watched your videos, came to class, participated, actually wanted to be there, and like took advantage of like the extra lab time that was there, you should do really fine in lab. And I'm sure every school does lab because you have to like know those skills in order to perform in clinicals. So that is my recap of lab. But moving forward, so that was my Monday. Also on Monday afternoons after lab, we had to wait around like about an hour or two to go get our clinical assignment, which means we had to go to our assigned hospital to get the assignment like on our patients so that we could start paperwork meaning we have to go see like what patient we have. We aren't allowed to go visit the patient that day, but we just go to like the lab or the computers and we go look at their profile. We write down like their diagnosis, we write down all the medications that they're taking, We're gonna do like a disease map, like on one of like the prospective diseases that they have. We did drug cards, like all that sort. So we had to stay around for that. And keep in mind, I did not mention, y'all, I am a commuter. I drive an hour and a half to school and an hour and a half back. So if I can do it, you can do it. You can do it. Say it with me. I can do it. You got this. Like, you can do this. This is for all my girls and my boys, all my men and my women that is watching this. You guys can do it. So on Tuesdays, that was clinical. I had to be at clinicals for 7:30. That put me waking up at about like 5:30, 5:45. And I would get dressed. I would be very prepared, and like I would have all of my stuff ready like the night before, get all my paperwork done. And then, you know, I would head to the hospital. Clinical was just a realistic version of what we would do in lab the previous day. So that's why I said get that extra practice in whenever it's available. If the lab is open at your school, definitely go in there. Don't just be like, oh, well, I know that already, or I could just watch a video. It's so different when you're doing something rather than just watching a video on it. Like, it's a lot of skills that I thought, oh, like, it's fine, like I can do that. Girlfriend, like if you don't go practice them vital signs, go practice actually trying to listen to them heart sounds. Like, go listen to heart sounds on different people, like different age groups, lung sounds especially too. Like, you got your people that's coming in there with emphysema or bronchitis. It's just different lung sounds that you could hear, and so it's good to be able to differentiate what you're hearing and what you're not hearing. So that all comes into play with your documentation as well. So clinicals would last about 5 hours, 5 to 6 hours, something like that. So when we would first arrive to clinical, we had to pass out trays because it would be around breakfast time. So like we would give our patients their breakfast tray, allow them time to digest their breakfast, and allow the CNAs to go in there and get like their first round of vitals. After that, we would go in, introduce ourselves. If we were scheduled to give medications that day, we would go introduce ourselves and then meet up with our instructor to go to the medication room and start like pulling meds. So sometimes we were giving like 2 medications, sometimes it was like 5 or 6 medications. During first level, we're not allowed to push anything through IV, so everything was strictly oral. And we also had a few sub-Q because many of the patients on our floor were receiving insulin. So we did that. We also stayed during like lunchtime too, so we would also pass out the lunch trays. Before that though, we would perform a head to toe assessment. We would help them to the bathroom if they needed any of that. We would clean them up. We would do like a full bed bath. That's also a skill that we learned in lab that I forgot to mention. We learned how to perform a complete like head to toe bed bath, and if they refuse the bed bath, then like we would just offer them like towels or wipes if they wanted to like do it themselves. We did encourage a lot of like independence with our patients, but of course not everyone was able to do some tasks like by themselves, so that's what we would be there to help them with. So clinicals was just a very good learning experience. I got to go to the cath lab and I saw a bunch of stuff down there, just listening to different patients that had just recently had stents placed, or if they had just gotten out of heart surgery, or just anything. It was just a great learning experience compared to my first time in nursing school. We did our first level clinical at a nursing home, and so just being able to be in the hospital versus a nursing home, it was a complete difference. I'm not opposed to being in a nursing home. It's just as far as skills wise, I was able to see a lot of my skills be like performed, and like I was able to do it like really well compared to like if I was at a nursing home. So that was just my opinion on it. So yeah, that was clinicals. All in all, it was fun. Like I said, it was a great learning experience. We met some great nurses, and I honestly, you know, like those TikTok videos whenever they're like, oh, we get the nurses that don't want to help the students out. I did not have that experience this semester. Like, all of the nurses were very hands-on with us. If they had something cool that we wanted to see, like a code or something, y'all, I'm sorry, a code is not cool. That is somebody's life, but you know, like you want to see it like in clinical. So if they had a code or something going on, like we were able to go, some of us were able to go in the room and like assist, or just like stand in the corner and watch, and just to see it. Me being that I had medical background already, like working in healthcare, I tried to let like a lot of my classmates get a chance to see, and I would just like kind of stand back just so they can all have a great learning experience. But all in all, it was pretty fun. Wednesdays were my off day. I finished clinical with an A. I passed clinicals. That was pretty fun. But back to fundamentals. I finished fundamentals with an A, and y'all, I worked my butt off for that A. I got that A by the skin of my teeth because I just knew going into that fight, I'm gonna just finish with a B. And then when we got our final grade, I just was like, what? When they told me I made a 96, no, I made a 94 on the final. And because like there's no extra points, all we get is, I'm not gonna say there's no extra points, there's no extra assignments. So there's no, oh, like do your homework and you get this, or do some connect or some practice questions and you get like points for this. Like no, it was strictly just 4 exams and the 5th exam was the final, and that's it. So if you didn't start off too strong, okay, you got 3 exams and the final, pick it up. And then if you didn't do good on that, it's like, okay, you got 2 exams and the final, pick it up. And so some people didn't get their rhythm until it's a scary situation, because you go from thinking like, oh well, I've passed anatomy, I've passed chemistry, I've passed all of my other classes with A's and B's, so I should be fine. Wrong. Nursing school is completely different, y'all. All right, so on Thursdays, moving on, we had Dosage in the morning and we had fundamentals or foundations of nursing in the afternoon. So Dosage, self-explanatory. When we first started Dosage, it was really just trying to identify what method works best for you. So some people it was dimensional analysis, some people it was proportions. So sorry, thought I had that off. And then for people like me, it was the desired over half. So once you get into that class, or even if you start watching YouTube videos, like it'll all make sense. Me personally, I just don't feel like a lot of that is needed, only because we have pharmacists that calculate how much the patient is supposed to be given. But of course, you know, sometimes they're not always there, like depending on the facility, or sometimes like you don't have a doctor or someone that's over the medication to quickly figure out like how much the patient is supposed to be getting, or even IV fluids or like heparin drips. That was very big this semester too. Dosage really wasn't that bad. Now towards the end, when we started learning titrations and like I said, the heparin drips, and it was, I think those were the 2 main ones that I kind of started having trouble with. I ended up finishing with a B, and I fought hard. Thankfully, I was able to complete all of my homework, and I think too because I was just more so like just focusing on trying to maintain my grades in fundamentals and health assessment, and of course studying for checkups for lab, and focusing on clinical. Thankfully, I was able to like play catch up and really just give it my all. And like the night before the final, I just remember saying, look, just you have to answer this many questions correctly. And that was the thing too, because our exams were not 50 question exams like our nursing exams were. These exams were sometimes 10 questions. So if you miss one, it's like out of 100, you automatically have a 90. And if you didn't know, a 90 is a B in nursing school, boo-boo. So let me just pause that. So the grading scale at Northwestern, this is for Northwestern, guys, Northwestern's nursing program. 92 to 100 is an A. 86 to 91 is a B. 80 to 85 is a C. 75 to 79 is a D, and a 0 to 74 is an F. So big difference compared to like the 10-point grading scales that you had like in your prereqs, like your algebras and your biologies and chemistry. It's a big difference. So back to Dosage. It wasn't bad, but if you just really put in the work, I know that you guys will be fine. So just depending on your school, just definitely, Dosage doesn't change, you know, like it's the same everywhere. So definitely if I could give any advice, it would be to, you know, like just start looking at YouTube videos, just trying to determine like what method works best for you when it comes to getting to the right answer. And that's what I liked about it. Like if one way didn't work for you, then you can try another way, or try another way, or try another way. Because our teacher, she's a dimensional analysis girly. She will eat the dimensional analysis down. Like me, I'm a desired over half girly. What I need, what I have, times the amount. So it'll make sense once you see it. So that was Dosage, finished with the B. Moving forward, next it was fundamentals, or like I said, foundations of nursing. If you don't remember anything else, definitely remember the nursing process. That's ADPI. So assessment, diagnosis, planning, interventions or implementation, and evaluations. That's that. Again, I'm not going to go into detail like what all of that is, but baby, if you don't know if you don't remember anything else in fundamentals of nursing, definitely remember your nursing process. You're going to learn about infection control, infection cycle, how it starts, how it gets into the host, different ways that it can, like diseases can be transported, whether it's airborne, whether it's droplet. So you're going to learn patient safety and comfort, like if you have a immobile patient or a patient that is mobile. Like I was saying, for clinical, if there was a patient that couldn't move, we're going to give them a bed bag. Also, when it comes to like transporting our patients or helping them ambulate, whether they're using crutches or there's different types of canes or a wheelchair. So all of that also falls underneath fundamentals. Patients have physiological needs, such as helping them with urinary elimination, bowel elimination. If they're having trouble like using the bathroom, like dealing with constipation, you see that a lot. And honestly, what I realized with the exams, you see a lot of issues with the very old population and the very young population. But I noticed in nursing school, they really tend to focus on the people that it affect the most, which is the very, very old and the very, very young. You're gonna hear that in every lecture. That's who they're primarily focusing on. Nutrition and hydration was a big one. Of course, with nutrition, different religious groups have different needs, different age groups have different needs. A pregnant woman versus a non-pregnant woman. It's just, you're just digging deeper into like the whys of nursing and fundamentals. And so once you get that rhythm of why are you doing these interventions and what are these interventions helping, you'll start to understand it more, and you'll know how to process it, and you'll know how to answer your test questions. You have to determine your studying style. So are you a visual learner? Are you like a repetitive learner? Like, do you have to keep hearing it over and over, like an auditory learner, I guess you would call it? Or do you have to like read it? Do you have to write it over and over? Like, do you have to have somebody like teach it to you? Do you have to pretend that you're teaching others? And so what helped me, we did a lot of study groups. It was 5 of us, and 3 of us out of the 5 were moms. And so we had to work, and we had to take care of children. We had to get children ready for school. So we did a lot of group FaceTime, and you have to figure out what works for you and like your peers. Or sometimes, you know, like you might not be a person that studies well in groups, but I do highly recommend like finding you a person or two, like 3, 4, 5, you know, so that way that you can teach each other. You know, you get in nursing school, it's not a competition. It's really, you all want to make it. You all want to make it today, and we all have one goal, and that's to graduate, become a nurse, and go out there and help the world. So yeah, I believe I touched on everything that I pretty much can remember for fundamentals. It's really just your basics, like just really introducing you to what nursing is as a whole. I loved my professors, and they were very helpful. We did get like prep use, that's through Lippincott, extra practice questions, just to kind of see what our test would be structured like. And so that is a huge help. And if I can give any advice to any of you, that is to definitely utilize your extra resources, even if it's not assigned, because just having those practice questions were like huge help. And the practice questions also help you realize, okay, well, I'm not really confident in this subject, so maybe I should go read up on this a little bit more. So that's my little intake on fundamentals. And like I said, I finished that class with the A. It is doable. You just have to find your rhythm and stick with it, and just go for it. Start off strong in the semester at the beginning. That way, like when it comes time to the end of the semester, you can kind of ride the boat and chill and chillax a little bit. Alrighty, y'all. So last but not least, the final class that I took this semester was health assessment, like the main class of health assessment that I told you guys were associated with lab. So I took that class on Fridays. That was a 3-hour lecture on Fridays from 9 a.m. to 12 p.m. And yeah, so health assessment pretty much just started off. I started noticing like in the very beginning, health assessment and fundamentals kind of intertwined a bit. You're pretty much learning the same stuff. So just of course that nursing process that I told you guys, the ADPI, and then just also like there are different interviews for different types of appointments or different interactions with patients. And so we learned that like you want to establish a good trusting relationship. You want your patient to trust you. The more they trust you, the more information they're going to spit out. With that being said, like if you can't establish a good relationship with your patient, it's kind of hard for them to trust you, and they're not going to tell you everything that needs to be told to you, and it's kind of hard to like diagnose like that, or it's kind of hard to treat what's actually going on if you don't know what's going on. So that was the first thing. So next you're gonna learn how to assess your patients. So first, just walking into the room, like you're gonna learn that you have to inspect your client, and then you're going to auscultate, that's listening. Then you're gonna do your palpation, that's like, you know, touching. There's different types. There's light palpation, moderate, deep to severe palpation, and then there's your percussion. So you're gonna learn all of that. You're gonna practice those skills in lab, and you're gonna actually perform it in clinical. So like literally all of the classes like really just all mixed together, and you're gonna be like practicing stuff, and you're gonna be learning. You're gonna be like, wait, like what class did I learn that in? Like, was it 30-40 for fundamentals, or was it 30-60 for health assessment? Did I practice this in lab? Did I actually do this in clinical? Your brain's gonna be going 90 to nothing, and it's absolutely normal. It is okay. Just breathe and you will do fine. You will get through it. Like, now is the time for you to just get all of your nerves out of you, because I'm telling you, like, you're gonna get to the end of the semester, you're gonna be like, I didn't even know how to do a blood pressure. Like, now I can do a blood pressure in my sleep. Like, you're gonna get tired of taking that stethoscope out. You're gonna be so excited to like learn it, and then it's gonna be, oh, I have to go get vital signs again. You will get through it, I promise. Next, we did go over doing a head to toe assessment. So learn how to assess the eyes. We're gonna be asking them if they're having trouble seeing, seeing things far away, seeing things up close. Do they have trouble seeing at night? Do they have a family history of like glaucoma, blindness? We're going to ask them like, do they have a history of headaches? Is anything bothering them, like any chest pain? We're going to ask them to rate their pain. We're going to ask them to describe their pain. Is there a pattern in the pain? Like, how often does it occur? Does it start and stop? Is it a constant pain? So, and really like health assessment is just like what it is in the name. Like, so you're gonna be assessing for clubbing in their fingers. We're gonna be assessing their pulses, learning where all the pulses are. Like, you're going to learn literally everything. You're gonna learn how to auscultate the heart properly. There's your 1, 2, 3, 4, 5. So there's 5 spots you're gonna be auscultating the heart, and you're gonna be listening to like the lungs, like in the front, your anterior. Like, you're gonna listen, I think, like in 10 different spots, and then in the back you're gonna listen to in like 18 different spots. So it's like, it's gonna be so overwhelming, but like it's super doable. And so I ended up finishing health assessment with a B. I finished with a 90 point something B. So I was just like, dang, man, like I probably could have had an A, but I took my B, like it's okay. And I was just so happy. So yeah, like I finished the semester with, like I said, a 3.67 or a 3.7. And so I guess now like the main question is, how did I do it with the child? And guys, this is just me being transparent. I made the mom decision to send my daughter to stay with a family member. It just made things a lot easier for me. She loves it there. absolutely loves it. It was hard for me, and I will say that, because of course you want your kids here with you, and of course you feel like, oh, like I'm neglecting them, but at the end of the day, I knew that I had a goal. I knew that I set out to complete this goal, and I failed out before, and like I didn't want to do that again. And also, like, I'm paying out of pocket this semester. Like, however, I missed her so much, I did end up going get her. Guys, like, it was super, super difficult. I ended up finishing the semester with her being here, but it was super, super difficult. And I realized, like, if I'm going to school during the day, she has to go to school. I'm working at night, and she has to, like, go sleep to someone else's home at night for me to go to work, because the bills don't stop. You know, I just realized she wasn't stable here, so I just did what was best for not only me, but for her as well, because I didn't want to have to wake up my daughter like at 5 in the morning or 6 in the morning when she didn't have to be up until 7 in the morning. So I guess the question to answer would be like how I did it while she was here. It was tough. I adjusted my days to, like, I had my sister, and so my sister and I were working, and so what I would do was try to adjust my days to, like, work whenever she was off. That way she can keep the kids, and then whenever I was off, she would go to work and I would take the kids. So it was tough. We got through it. It was a lot of sometimes I got burnt out. I did miss class sometimes. Sometimes she was late getting to school. Sometimes she was the last kid being picked up from daycare, and that is just life. Like, you know, you have to do what you have to do. Sometimes I had to call someone else to see if they could get her from school if she needed to be picked up. There were times where I was running off of literally like 3 hours of sleep. It was times I worked overnight and got off at 6 in the morning, and I had to come straight home, shower, change out of my work scrubs, put on my school scrubs, and go straight to school and drive an hour and a half to school, like, dark, and it was tiring. But I had to tell myself, like, you have a goal and you have to complete it. And when you know you have tiny humans depending on you, it just hits different. So I hope that, you know, this could, like, speak to someone out there. I hope that it touches, if it doesn't touch all of you, I hope it touches one of you, and it motivates you guys, and it inspires you guys to go out there and get it. School isn't going nowhere. It's no competition. It's no rush. This journey is you. Like, focus on your lane. Don't worry about, oh, who finished. Like, y'all, I watched so many cohorts, like, pass me by. I attempted school so many times, and this time is just so different. You gotta put God first, and you just gotta know, like, you have to believe that you could do it. And when you got God on your side, baby, listen, anything is possible. I promise you. Y'all, I cried. It was tough. Like, I called my friends. I called my sister. I was calling everybody. I was calling my parents and just telling them, okay, I'm gonna finish this semester. I'm taking the next semester off because I need to work. And then, like, just working. I was PRN, so that helped a lot. I was PRN, but I was able to work full-time hours. So, like, whenever I could go to work, I would go to work. If I couldn't go to work, I couldn't go to work. But that just had me working even more harder. The bills don't stop. So, with that being said, like, I hope you guys enjoyed this video. Definitely comment down below any content that you guys want to see in the future. I do plan to vlog moving forward this upcoming semester, and school is actually starting in the next couple of days for us for level 2. Your girl is going to be taking med-surg, pharmacology, and med-surg clinicals. So that's what the focus is going to be on for this upcoming semester, January 2025 to May 2025. So I will definitely be doing more in-depth vlogs of, like, you guys actually coming to school with me. Definitely check me out on TikTok at v.dejaraquel, on Instagram at dejaraquel, and also don't forget to subscribe, like this video, and comment down below. Thank you guys so much for tuning in. I hope you guys enjoyed. Bye.